In Madison, Wisconsin, Dr. Stephen Taylor bicycles to work from his apartment. As an intensive care physician, he had never experienced the day in and day out challenges the pandemic brought to his team.
When I'm out and about, walking down the street or riding my bike, I wear my mask because I want to make sure that whoever I'm coming close to or in contact with is protected from me. And just even symbolically, I think that we need to make sure that we're kind of as a society willing to protect each other from needing to come to this environment. Good morning. Emotionally, there are times when it's very difficult. I'd say that at the very beginning, when we were preparing for the surge, we were doing some orientation for other physicians and APNs that were going to come in and help staff the ICU. And in those sessions, we had some serious kind of sit-down conversations about the possibilities of having many of our patients die, having an environment where families couldn't be at the bedside. Can you squeeze your right hand? Give me a squeeze. With the onset of COVID, the patients even more so became our kind of personal family members. You know, we all decided that no one would suffer alone. No one would die alone. We made sure the families understood that when things weren't going well, that we were at the bedside with their loved ones. So I'd say more so than usual, we absorbed a lot of that loss. Make recommendations. So it's been stressful, it's been hard, but we've got a resilient team, and I think everybody checks on each other. We know that there are interpersonal risks that we kind of keep an eye on to make sure that our coworkers are able to vent when they need to vent, they're able to cry when they need to cry, that all of us get the support that we need to get through this. Good morning.
I'm going to scan your bracelet.
Tandy is a charge nurse on the 5th floor of SSM Health St. Anthony Hospital in Oklahoma City. During the COVID-19 pandemic, she experienced many more bad days than good.
Our norm is 1 or 2 people coding, people having to go to ICU because they can't maintain their oxygen status anymore. They have to be intubated and put on a ventilator. People dying, comfort care, end of life, holding people's hands while they die, Zoom meetings with their families so they can say their last words to them. It's extremely hard and draining physically, emotionally, in every way. On my way home from work, I call my mama. She always makes me feel better and puts me in a good mood, and just listen to her voice, especially when I haven't seen her in so long.
Hello?
Hi, Mommy.
Hi, sweetheart.
What are you doing?
Oh, just watching the news. What are you doing?
I'm just driving home from work.
My day was good. How about you?
My day was really good. Nobody died, and we didn't have any rapid responses, and
Isn't that wonderful?
it really is. As hard as it is on us, I can't even imagine what the families are going through. These people dropped their family member off at the door to the emergency room, and they walked in, and they never expected that that would be the last time they saw their family alive. And that happens a lot, and it's devastating for everybody.
And you are the hero of the family.
I'm not any kind of a hero, but I appreciate you saying that.
You're my brown-eyed girl, and you're a hero and a princess.
Sometimes I think I shut my emotions off so I don't have to feel things, because then I would feel too much. And I let it build up, and then it all comes out at once, and I'll come home, and Todd's really good about knowing if she wants to talk about her day, or I just need to give her a hug and let her cry it out.
She doesn't need to do anything. She takes care of people all day, so I just try to take care of her when she gets home. If she loses a patient, which happens quite a bit, I just hate that she has to go through that. But they all go through it. Every one of those nurses goes through that. I just try to be there for her, whatever she needs.
You're not in it by yourself. When that patient codes, when you have to hold that patient's hand, when you have to go, I need a minute, I've got to step away for a minute. There's somebody there that has your back. And if it wasn't for the coworkers that are absolutely amazing, there's no way that I could do this. And I don't think any of us could without each other.
The last thing I remember hearing is, he's reviving. And so I guess they had got me in an ambulance at that time and had put the air mask and tank and stuff on me and rushed me to the hospital. The thing that's really like, excuse me, I'm sorry, man. I thought I was taking my last breath. I honestly thought it was over. You haven't had to go through what I went through. So naturally, you feel safe not getting the shot because everything is going good with you, because I thought the same thing. I seen the nurses struggling to take care of us. And I seen how their spirits would drop when they lose a patient. And so to be leaving and seeing everybody happy and clapping and cheering, man, that was awesome. That blew me away.
I love y'all nurses. Y'all the best in the world.
It's the sincerity of the staff and everybody that was involved. You know, they was, like, I just felt like they had accomplished something too. You know, it was like, it was for us all, you know, them, me, everybody that was involved, you know, and so I wanna help. And I believe getting the shot will help. What COVID to do to you to take your life, to take your last breath. So I'm taking the shot. At least I know I tried to save my life. Not because of what I heard somebody saying, because that almost got me killed. Almost died from listening to other people. Man, that was hard for me. And it's still in my head. Trying to go to sleep at night, I wonder if it's gonna attack me again. If you don't wanna get this shot, don't get it. But don't try to tell other people not to get it. Keep it to yourself. Let us make our own decisions. I don't ever want to go through nothing like that again. I'm 60 years old, I want to live. I still got life in me, man. I want to live. I don't want to die from no corona or nothing like that. I don't want to die like that.
At an assisted living facility in Mount Calvary, Wisconsin, the residents receive visits from the animals living on nearby Cristo Rey Ranch. Facilities like this one across the country were hit hard by the virus, and visitors were limited for more than a year. Sister Stephen Blessel brings her furry friends indoors so the residents can enjoy much-needed hugs.
Their life was kind of on hold, in a sense. Initially, they were doing very few activities and no family visits except through a window, and it really perked them up. What do you think, John?
He gained a lot of weight.
He did gain a lot of weight. To have them come in the house and be able to interact, for us it was such a blessing to see how they were so happy for that. You know, it just breaks up the monotony of what they were going through, I think.
Just makes you feel good to see something live and moving again. That they come up to you and see you, which is more than what a lot of people could do, you know. It's very, very uplifting at this time when we couldn't have company. You just want to take them and hug them. Yeah, they do a lot for people. You wouldn't think that, and I never thought that years ago, but as you get older, you really do feel that. It's really uplifting.
So come kiss Rosie. Oh my God. The smiles on these residents was just amazing when they would see these animals looking in at them. We got a couple letters, just what it meant. That was the first time their dad was smiling since they were locked in. They would call their family and tell them about this, and they were really excited about it. So it's just really been a rewarding experience for all the people who helped me. You know, they're all like, I'll do it again. You know, I have a long list of people willing to come and help.
Talk to them. You're done. It brings joy to them and something to laugh about, and they have something to talk about.
Have good breath?
No. It's just such a bonding with something alive, and it's good. It's really good.
As the virus gained momentum, our nation's healthcare workers needed a tremendous quantity of personal protective equipment to keep them safe. Providing nurses and doctors with these vital supplies was the job of those behind the scenes, like Megan and her teammates.
Typically what we would be sending out is gloves, gowns, N95 masks, hand sanitizer, IV fluids. There were times where regions were in short supply of product, and we found a volunteer within our organization that flew down, delivered product, and flew right back. We didn't want them to run out, so we had to do everything we could to get the product there as quickly as possible. It consistently keeps me and my supply chain colleagues awake at night, struggling to sleep, because we want to make sure that we have what is needed. The frontline workers are the heroes. So if we can get them what they need to be those heroes, then that's what we need to do to support them. We want to make sure that we bring back any of the supplies that have to go get tested for QC. Yay! I'm married and we have an almost 2-year-old son. His name is Kellen, and he is such a joy to be around. I find myself constantly chasing him because he's always screaming and having so much fun. He wants to go down the slide by himself. He's independent, but I'm not ready to let him go up everything on his own yet. My mom was diagnosed with COVID-19. When they authorized a compassionate care goodbye visit, I booked a flight, had an outdoor visit, goodbye visit with my mother, and she passed away 5 days later. I never believed that people are waiting for you before they pass away, but I believe she was. She never got to meet my son. My mother wanted her ashes spread over La Jolla in San Diego, found a company who spreads ashes via airplane. Now we have a lifeguard tower where I can go back and reflect on where she was laid to rest. If anything with my mom's passing has changed with the work that I do, I didn't think it could possibly be any more important than it already is. But it is elevated to such a higher level when you are personally impacted by somebody due to COVID-19.
Doctors and nurses at SSM Health St. Mary's Hospital in Madison, Wisconsin, took care of retired Circuit Judge Daniel Klausner. He almost didn't survive the virus.
The judge had a couple times where we didn't think he was going to make it. He was on BiPAP at 100% FiO2, which is the highest we can go, and if he didn't bounce back from that, he would have not made it out of here.
Did you tell her about your morning? We started with the low blood sugar, so we had 6 chocolate ice creams.
I had 6 ice creams before breakfast. Can you imagine going to work every day going, I hope I don't lose anybody today. I don't know if I could do that, but they do every day. But I can tell sometimes something has happened. They won't talk about it, but something has happened. But yet they're willing to come in here and smile, even though I'm short-staffed. They all take very good care of me.
You holler if you need anything, okay? Yeah. Alrighty.
It's been hard. Makes the anxiety levels go up really high coming into work, not knowing what you're coming into. Cried a lot of tears because of it. But you just get to know them really well because you're the only person that's in and out of the rooms for the most part. Take it personally almost.
I have a severely disabled grandson. I can't wait to give him a hug. You never talk, you never walk. Doesn't mean I don't love him. So they can't bring him here, so I want to go there. So once I get strong enough and be able to get out, I'm gonna.
Look at that. Nice work.
Somebody who says they have a constitutional right not to wear a mask, this is what I say to them. You might have a constitutional right not to wear a mask, but you don't have a constitutional right to kill me. Thank you, everybody. You did make a difference. Oh, boy. Keep me on your prayer list. I need all the prayers I get, and keep this place on your prayer list.
Hey, Joe, I'm just going to take a peek at you, okay?
Dr. Wolf specializes in infectious diseases like COVID-19. This virus, though, was different from others she had seen.
We were learning about this virus, about what it could do to our patients while we were taking care of patients. And that's terrifying. Get some rest on the ventilator, okay? They're going to do that procedure on you today. You want to be able to write? No? You want to get off the ventilator? He's trying to tell me he needs something, and I don't know what he needs. It's difficult because when they come to the hospital, there's so very little that we can do. We can support them with oxygen. Back in May, we started giving people steroids, and that has helped tremendously. But beyond that, it's time. It's oxygen, steroids, and time. That's really hard to hear. Why can't you give me an antibiotic? Why can't you give me Tamiflu? Those things don't work.
Hey, bud. How are you today?
In December, we had access to the vaccine, and that was the first time there was joy in this hospital since last March. And you could feel it. A lot of my colleagues, they separated from their family because they were so scared of taking things home. And my husband and I spent some time talking about that. I mean, I carried a little bit of fear with me coming home. But we decided that if I was going to go to work and take care of COVID patients, I would do everything that I could to be careful. But we weren't going to break up our family, especially not knowing how long this was going to last.
The science was really unsettled.
Yeah, we didn't know if it was droplet.
Right.
Or contact, or airborne. We knew that I was the risk. Wore scrubs to work, everything went straight in the wash. I got straight in the shower, didn't touch the kids until I was out of the shower. And even to this day, Rowan will say, "Do you have the virus on you?" So he knows that if I've just come home from work, he cannot touch me.
At drop off at school, we do the same thing. Our goodbye is stay away from the virus, you too. Yeah, he came up with a lot of language to try and figure it out.
I hope whatever residual effects as they get older are a little bit tempered. And I think just like with the nurses and docs experiencing some PTSD, my hope is that as we start to do more things, as we kind of re-enter, some of that fades away over time. I do think we'll probably see another pandemic. Since I've been alive, we've had HIV, which killed hundreds of thousands of people, continues to infect hundreds of thousands of people. We had H1N1, which was a respiratory pandemic. We had Ebola in Western Africa, and now we've had COVID. So I think it would be a little bit foolish to think we couldn't see another pandemic. And my hope is that we learn from some of the mistakes that countries have made over the last year, and we're better prepared for the next pandemic.
How important is it what your mom was doing over the past year?
I have a mom who saved lives. Can I go play with him?
Yeah.
Marlon checked into the hospital in Oklahoma City when he started experiencing symptoms of COVID-19.
My throat was hurting. I was kind of having shortness of breath. By the time I came in, they just brought me right up here to the COVID unit, had me on oxygen within 30 minutes of me getting here. Personally, I had no pain. I just couldn't breathe. And I think that's even more scary than having any pain at all. I'm slightly recovering, slowly. They say it may be a couple, 2, 3, 4, 5 weeks before I can get back on my feet. And even then, I can't move more than sitting up, getting back in bed, and you're just worn out like you ran a marathon. And what's so bad is there's such short breaths. You can't take a long breath. It's just, and that's nothing worse than that, because you want to go, and you can't do it. You just can't do it. And it's just, to me, that's miserable. I've never had that feeling in my life. I've never been afraid of too much. Boy, this has terrorized my head. Because it plays with your mind, because that's one of the main things you have, is you're just laying here, there's nothing to do but you and time. These people come in here every day, breathe it, and work around it, touch it, and everything, and yet they don't even think twice. You pray that they don't catch anything. Basic instinct of humans is to just take care of humans. We will take care of each other despite anything and everything that happens in this world. We always come together. And it may not always be the best, but one thing that makes us the human race is that we come together, we strive to help each other and to make each other better off than we were. And because of that, that's why our world has grown exponentially as it has. Like the other night, I took a little sponge bath here. A little girl came up and said, "You want me to do your back shoulders?" I was like, "Would you mind?" She said, "No." And just that little bit. Oh, it's just like your mom coming up. She's rubbing your back. It just means a lot. To me, it means a lot to have that human contact. It's like a little electrical spark that goes in your body that helps build you to get by another day.
He's been great. So he's totally calmed down. We'll put his mask on him and he will try to totally relax his body and take really deep breaths and slow down on his own. They don't all do that. A lot of times they're stressed and they panic and they start breathing harder and harder, but he's done really well.
After a COVID-19 patient leaves a room, LaRonda's job is to sanitize everything from top to bottom so a new patient can be admitted. This process takes up to 2 hours to complete.
This person passed on, and sometimes it can emotionally get you to where I broke down and cried, or I had to leave the room or leave the floor for a minute and get myself together. No more pain. Who wants to suffer? Job description is to clean and sanitize. So I signed my name on the dotted line to do it, and I feel like that's important to me to achieve my job to the best of my ability. And then, to where people can actually lay in a clean room and don't feel like they have to take something home that they didn't bring in. I'm more comfortable on the floor than I am out there. I feel scared when I'm out there because I'm not in the PPE. When I go out there to have lunch or clock out or whatever, a little anxiety start coming because I'm not properly to the maximum like I am in here, Every day is a good day for me. I'm a positive person, so I keep positive vibes all the time. I'm not a pessimistic person. It's hard to steal my joy. My prayer list has grown, I pray for them every morning when I get in my car. I say a prayer for St. Anthony's every morning for the nurses, the patients. I think you have to have a great sense of work ethic and be mindful that this is serious, And I'm just speaking for me. If I can't give 110, I won't come to work. I will not compromise nobody's safety or their sanitation. I'm not going to walk out of here until I know everything I feel like has been touched. It's a 7-step process that we have to do. And so with those 7 steps, it's not something you can just whiz by, because those 7 steps are put in place to make sure that everything is sanitized. We're dealing with a dangerous killing virus that don't have no discretion where it lay. This is why it's important to me, and I do the job the way I do it, is because I don't want nobody to get this from my selfishness. So that's why it's important to me to help control this, because this is real. Okay. See you later, Miss Sheila. Bye-bye. I'm gonna grab your trash one more time.
He is a wonderful kid. Super smart, loves dinosaurs, loves school, just loves life. He is just an amazing kid.
Henderson?
8-year-old Cash and his entire family were diagnosed with COVID-19. Cash became very sick. He's feeling better now, but is still dealing with the lingering effects.
When he came into our room, you could feel the heat radiating off of him. You know, when I checked his temp, it was like 104. So we decided to take him to the emergency room, which I tried to avoid because as a nurse, I know how much illness is in the emergency rooms right now. But we got there, they tested him for COVID, and it was positive. So they decided to go ahead and transfer him. They took him by ambulance. The poor little guy was just so sick when they took him. Of course, I wanted to go with him. That wasn't an option, but he didn't even care. He just didn't feel, he was just so sick. When we got here, everybody was wonderful. Cash slept most of the time at the hospital. So when he did wake up, he wanted chocolate shakes. So that's pretty much what he got. But the staff was wonderful. They explained things. I had no problem getting answers. Everybody was wonderful. They were very attentive.
So big breath. And blow. Keep going, blow, 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 blow. Very good. Perfect.
He feels like he can't catch his breath all the time, or he feels like he has no energy. But they don't know everything that is involved yet after having COVID.
Dr. Elmers will be hit, okay?
Cash came home from school the other day, and when I asked him about how his day went, he told me 2 kids had gotten pulled out of class. He told me that the teacher informed them that, you know, they had COVID, that they had to go home. He said, oh, well, I only have 4 kids in my class now. I'm like, didn't you start out with 14? He's like, yeah, they have 4 kids in their class right now because everybody is out sick with COVID.
So, you know, with the COVID, a lot of the symptoms, we're still trying to understand what they are. And
as a nurse dealing with COVID every day, I see the outcomes of unvaccinated people mainly on a lot of oxygen, ending up intubated, not coming off of intubation, and ending very poorly. And when Cash got COVID, it did not play out well in my mind at all. And I am so glad, so thankful that his outcome was a good one.
All right. Sounds good. Round it out.
Dr. Albers just said that Pfizer is coming out in the next month or 2 with a vaccine for 5 and above, and Cash will get vaccinated. Yes, absolutely.
Christian and Amber both work at St. Mary's Hospital in Madison, Wisconsin. Not much was known early in the pandemic, but the virus affected their family immediately.
We received a phone call that Christian had been exposed. The patient did not present with typical COVID symptoms. It was very early, so we weren't all wearing masks with every patient interaction. And because we were still learning about this virus, he was asked to quarantine. And I was mad. I don't know why my first emotion was anger, but it was. I was mad. I had to tell my boys, you can't go near daddy right now. You can't hug and kiss him. I was mad.
PB&J, you want snacks? What would you like?
I want to get a snack.
Yeah, go grab a snack.
I ultimately was not diagnosed with COVID, but at the time, you don't really know what it is. It was still so early on then. What does that mean for me? Am I going to get really sick? Even though, like, my line of work, we rarely know at the beginning what's going on. We have to figure things out pretty quickly. But when you're exposed to something you've never seen before, that gets outside our area of expertise pretty quickly for anybody. So that unknown part of it was difficult. There are certainly people that are denying it. I took care of somebody who refused to put on a mask. That's difficult to deal with because there's still a federal law that we provide medical screening exams to every patient who comes to the emergency department. But I'm not convinced that ethical obligation involves us risking ourselves in that way to expose ourselves potentially to something like that. You make your way through it, you do what's right for the patient, but taking the small step of wearing a mask didn't seem like a big ask to me. But we still did our job.
Hello, Dr. Rickman, how are you?
It's been unbelievable, unimaginable, stressful. But when I go to work, yes, it's in the back of my mind that I'm coming here and my health could be and is at risk, but it makes me slow down, wash my hands, have the mask on, think it all through. And I just have to approach every shift with focus.
Hi. All right, I got your pain medicine.
Amber did a great job for me. And I told her, I said, I think you guys are going through so much, and I wonder if, like, she's holding my hand, I hope there's somebody holding hers. To me, I thought she did today with such grace. I never felt like, oh, she doesn't care, she's not concerned.
Thank you. The hardest part of all of this for me is that I'm unable to show you that I'm smiling. Yeah. I've been smiling the whole time. And it would be so nice to recognize our faces outside of these walls, but these masks make it just a bit more challenging.
It's true, I cannot see your smile, but I can hear it.
It's there.
I can hear it.
We're all going to be okay. And I've been saying that to so many people. My mom, my sons, my husband, my patients. This'll all be okay. And at times I wondered, was I believing those words? And then I was glad for the mask to hide my face. Was I believing in all of this? Would it be okay? But I know it will be. There's still hope.
I do heat and air and plumbing, electrical, and then run a crew that rehabs insides or outsides of the complex where needed. I do have family. I have a cranky wife. No, just kidding. A good wife. I have a 33-year-old daughter, a 27-year-old daughter that just got married, and a son that's almost 18. Of course, only in the house is my wife, my son, and my dog. Everybody tested positive, and nobody has symptoms, so I'm the lucky one. I suffer from anxiety and depression real bad, and so that compounds it. And I'm scared. My mother-in-law just passed away about a week and a half ago from complications of COVID and pneumonia in the lungs that I have. I mean, this is still new, I can do my job backwards, drunk. Well, I don't drink, but bare, naked, in the dark, and everything else. But I've been doing it 30 years, and this is brand new. So, what these guys on the front lines are doing. I mean, you guys are the freaking heroes.
It's been pretty tough. I feel like I've never had any issues with depression or anxiety. But I realized in the last few months I have, and I think most of us on the floor can agree with that. But I love this unit, and I've been a nurse for 25 years. So at my age, I probably should be doing something a little different. But This is what I love to do. You're a great patient. I know you don't want to be here, but
Nobody does.
no.
Everybody's been amazing, but you just kind of stood out.
Well, thank you.
And like I said, it really helps. I cannot say enough about you, young lady.
I appreciate hearing that.
I always like it when you walk in the front door in the morning. It's like, yay! So, and not that anybody else is bad, but it's like, you know, not that I have favorites, but you know, I got favorites. I don't know how I'd get through it without my family. I mean, you've been in here a few minutes and look what a mess I've become. So it's tough. And I've got it better than I'm sure a bunch of them up here. So, I'm very blessed.
Dr. Alexander Garza served as President Barack Obama's Assistant Secretary for Health Affairs and Chief Medical Officer in the U.S. Department of Homeland Security.
Good afternoon, and thank you everybody for tuning in for today's briefing.
When the pandemic began, Dr. Garza was named Incident Commander for the St. Louis, Missouri Metropolitan Pandemic Task Force.
It's been a bit of an adventure getting the right picture in people's minds about what this pandemic is about.
Hi, how are you guys?
Good. How's things going?
Not too shabby.
Yeah. How's the patient load doing?
What are we at? 17 patients at the moment.
Getting the message out, offering advice, but also not being afraid to criticize as well when it was needed. Making sure that it was a truthful narrative, dispelling rumors and myths about the pandemic. But as long as we stuck with what the truth was and with what the evidence said, then we knew we would be on the right side of this.
We appreciate you talking and representing us because, you know, we went through a lot, so it's nice to be recognized.
As vaccines started rolling out, it became entered into a new phase where I think people became much more hopeful. And there you go.
It's such a relief to finally get this shot.
Isn't it?
Oh, yeah.
Well, how are you?
Well, I'm obviously one of your groupies because I follow you.
I think I would just want everybody to understand, especially, you know, people that, you know, would say things like, well, this is just like the flu, or, you know, gosh, you know, wearing a mask isn't important. If they could spend one day in the lives of some of these workers, I think they would have a change of mind, or at least I hope they would. They took on this huge burden, a worldwide pandemic, and a lot of it fell squarely on their shoulders. So I would just want people to recognize a lot of the heroic work.
That's the most I've seen him open his eyes the last 2 days, so.
Good. Good.
He knows you're here.
I hope so.
I mean, we know they can hear us. It's just they don't know who we are. They don't know what's going on around us. So if we can make something somewhat familiar to them, it's great. And having family members is probably one of the best things for these patients.
Since Kevin is no longer contagious, Ava is allowed to visit her husband's bedside.
He's had some really, really good nurses. I mean, they're in here constantly doing stuff with them, adjusting what they're doing every time his numbers aren't where they need to be. And they seem to really care. And the doctors, it's remarkable what they can do. I'm glad we're here. Let me just say that. When they decided to bring him here, it felt totally different. It felt hopeful, like there was hope. He's a good man and we don't want to lose him. And his grandkids don't want to lose him. They love their grandpa.
People can say I'm just playing with numbers and going back and forth on drips and titrating and suctioning and turning the patient to make sure they don't get wounds, but it's more than that. I'm trying to keep someone alive as best I can And when you lose them after being with them for a week, maybe a month, we had someone that we took care of for 6 months and they passed away. And it's just heart-wrenching. I can honestly say I have had PTSD episodes, I've had panic attacks, I've had to seek help for it because of the trauma that we on the front lines have gone through. It's not only terrifying for these family members and the patients themselves, but for the nurses as well. And I know I'm not the only one out there. I've talked to multiple respiratory therapists. I've talked to doctors. I've talked to about every single one of us on the front lines, whether it's our cleaning staff. We all have the same concerns because our families, what if we get it? There were times, I wondered if I was gonna see my son again. And that was the scariest, not knowing.
We can look at statistics and trends all day, but where it really hits home is when you go to the ICUs and you talk with the people that work there. You see what they have to deal with. Because now you're not just talking about a political issue or a scientific issue. Now it's real. And you can't be afraid when you're delivering that message that it's going to offend somebody. Because you're in some ways you're the voice for those people. And I never wanted to forget that.
The damage from the lungs looks like it's strictly from the virus. The lungs get injured very quickly and they take a long time to heal, and that's what we're up against.
Dr. Greg McInnes works in an intensive care unit in Oklahoma City. He wishes more people knew what actually happens inside COVID units.
It just surprises me the complacency and the casual attitude that people have about this disease. But we realize we want to be close together, and it's hard to let go of that. People want to go have a cup of coffee and they want to get together to go to church, and it's so hard to let that go. But it still surprises me that people are doing it when they have family members who may be dying or have died. It makes me think that we're not getting the word out very well. You don't know who it's going to be that's going to end up on my doorstep. I think that's the surprise, that we don't see more camera time for the inside of our COVID units. We get people that are here that are angry that they're here. Yeah, the ones that thought it was a hoax and how did this happen to me? We had a trucker come through here that he was driving through on his way to North Carolina. We said, hey, you need to wear that BiPAP. You need to wear this to keep your oxygen up. I'm not wearing that effing thing. I'm not having anything to do with it. Very angry guy. And pretty bad diabetes. And he got worse and worse and worse.
You're listed as significant other. How long have you been with him? 5 years. I'd call that pretty significant. So I'll be in touch with you if there's any major changes. All right.
I think we have some sense of protection from this vaccine, but let's say something's 90% effective. I mean, you're still going to have 10 out of 100 that can still catch coronavirus. And we don't know if we're going to hit herd immunity if we vaccinate some percentage of the population. Was never achieved with smallpox. They hit the numbers with smallpox where theoretically they should have been at herd immunity. And that didn't happen. Is it going to happen with coronavirus? I don't think anybody knows. I think we hope that that's going to be the case, but we don't know.
I think others would tell you that were around me that I was all consumed. And that's what was required.
Laura Kaiser is president and CEO of St. Louis, Missouri-based SSM Health. Exercise helps her handle the stress of leading through the pandemic.
In healthcare, we're actually really good at taking care of infectious disease, but we couldn't get all the supplies that we needed. We had some people wearing trash bags instead of gowns. So we were just scrabbling and putting things together. I was spending a lot of time on the exercise bike, answering emails, sending emails out, looking at everything that I could find relative to news about what is this virus, what is it that we need to do, looking for answers and guidance, communicating with other colleagues. What are you seeing in the state of Washington? What did you do with this? So that we weren't learning everything from scratch. When I hear the myth that hospitals are profiting greatly from COVID and that we're cheering that we have full hospitals, it's heartbreaking because there are probably a few people in healthcare that are interested in making lots of money. I don't know any of them. We're all here because we're called to healthcare and we want to help people to the best of our ability. And so the first time I heard that, I thought, oh, that's weird. I just thought it was propaganda. But then it started to have a little bit of a drumbeat and I thought, oh my gosh, I have to share with people our own financial position. And so in March of 2020, which is when this all began, we discontinued elective procedures. And so we lost hundreds of millions of dollars. It's folly to think that this is something that we're cheering about. It's a human crisis. It's deeply upsetting. We don't have narrow channels, if that's your question, meaning we're open to people coming from different places. Truly, what each of the caregivers does is nothing short of extraordinary. And watching some of the stories that I didn't know for different nurses and doctors and therapists and patients and families, happy tears for people that were homecoming, but very sad, tragic tears for people that didn't make it. And so I think we have a responsibility to share those stories because not everybody has a front row seat. I fear now, as the pandemic continues, that all of this extraordinary, heroic work that was recognized so beautifully across the country, I fear now that we are all thinking this is normal. The heroism is just to be expected. And I think you should never take something that is so remarkable and precious and finite for granted. And so I'm grateful. I'm grateful to the bottom of my toes for how people have shown up, because people in healthcare do that. They show up and just do the right thing even when it is really hard. But we each have a limit. And so we need to make sure that we're giving caregivers a chance to catch their breath, because we've really taxed the system to its extreme, and we need to be mindful of that because it is delivered through the hands of human beings who need rest here and there to recharge their batteries so they can get up and do it again.
I was worried that Gloria was going to die. So I brought the iPad into the room, and Gloria started talking to her family and saying how scared she was. Then her son came on and just seeing his emotion. It was gut-wrenching for me to watch. But I also felt privileged to hold the iPad for them so they could have that communication with each other. That's going to stay with me for the rest of my life. There was a lot of patients that went to the ICU and we never got to see them again.
For the reunion with her caregivers at SSM Health St. Agnes Hospital, Gloria wanted to walk in on her own.
Oh, it's so great to see everyone. Thank you. I remember going to the hospital. I remember going up to that one room. And that's it. And I guess maybe that's a good thing, right? Yeah, I only remember the good times with you guys.
The most wonderful thing was having those iPads, you guys, so that you can at least see someone's face is so touching. And it means the world. It literally means the world. We thought we were going to lose her.
Thank God I didn't know that.
Thankfully, someone's very stubborn.
You guys were so good to me. I mean, what you had to go through cleaning me up Yeah. I kept telling him, I said, oh, I feel so bad. He said, don't worry, we do this all the time. I'm thinking, what a job.
And we keep coming back.
I know, right? Yeah. You got a good heart. Good heart. Well, thank you so much.
You betcha. You take care, okay?
Oh, I will. Thank you. Thank you. I appreciate it. Thank you so much for everything you did for me. I appreciate it so much.
And watching you say goodbye to everybody, it just means so much to me to see you.
Aw, thank you.
How you're doing now.
Thank you.
You were a good turning point for us.
Oh, good. Good. I'm glad.
You gave me as much as I gave you, that's for sure.
Yes. I think about you so much. Anybody around when I said, oh, thank God I had my eyebrows waxed?
I remember that.
For the initial part of my illness, I stayed at home. I felt that I was just tired, fatigued, and never considered COVID as a diagnosis.
After almost a year, Dr. Qureshi is also still trying to recover from the devastating effects of the virus. As an emergency pediatric physician at SSM Health Cardinal Glennon Children's Hospital in St. Louis, he continues his rehab so he can return to the work he loves.
I was expecting that maybe they'll keep me for a 24-hour hydration reasons, but nothing more than that. When I started waking up, I wasn't sure what was happening to me. Then the nurses who were taking care of me, one of them I recall, he was so excited to see me open my eyes. He said, you were on ECMO for 2 weeks, prolonged coma. I said, what? Mentally. And you pretty much know the chances of recovery from that was very slim. And at that point, I realized how sick I had been. So my mortality was 95, 98%. And then they called my children and my family. They came on FaceTime, and I could acknowledge the smile on their face. And the first thing they said, Dad, thank God, you're looking good. You'll recover. Don't worry.
We were doing 10, 12 miles a day before he got sick, and watched him not be able to do that anymore. To hear him after an hour of physical therapy and just hear him gassed, absolutely exhausted. I've never heard him like that, ever. And it's hard for us as a family to really fathom it because you don't recognize your loved ones to ever be helpless. He was a hero to all of us. He still is.
Look at you, you're back, baby. Battle scars and everything.
To see your heroes not be able to live to their expectations, right? It's him who wants to go back to work. He craves it. It's who he is. It's who he wants to be. He's never wanted to retire. And I'm sitting here telling him Dad, you sure? Okay. And it's a tough conversation for me to have because I know he's had so much planned.
Okay.
Very good. Let's let you come over. We'll have a seated rest break.
When I came home, in less than 48 hours, my Glennon family, they were at my doorstep. And I have never experienced anything like this. I always treasured their work group, but they became a part of my family. And the energy they radiated to me, the support they gave me, I can assure you, that's one of the very important pillars of my recovery phase.
To know that there have been so many people the world over praying for him. You will never understand how grateful our family is to have him back, and we can't wait for him to have you guys back at work with him.
We love you.
I always was made to feel that I'm wanted, that they want me back again. They were in touch with my family, they would talk to them, sending cards. There was one of the comments which somebody wrote that if God were to ever get overwhelmed with prayers, now is the time. No money can buy that love and affection, period. It's not a work family. Every single person has been involved in my care, somehow or the other. I'll never be able to thank them for that. I'll never be able to thank them for that.
The world has turned to silence, retreating to our homes, but somewhere in the quiet, we know the danger roams. What does the new day bring? Another case of sorrow, another tragic end. Hand in hand across the distance, weary bones and wounded hearts, through the tears and trials and tragedies.